Okay, so I just want to give an overview, a quick revision on the anterior compartment of arm and also about the cubital fossa. I know that it was there in the question, but I want also to give a clear view of how you should answer when you're given, let's say, describe the cubital fossa or describe any structure, right? Um, yeah, so we'll look at the muscles of the front of arm quickly. Then also look at the nerve supply and actions. Cubital fossa, the boundaries of the cubital fossa, the contents, as well as the applied anatomy of this. So whenever you're talking about a muscle, you start with the origin, insertion, innervation, action, as well as you also include blood supply. Okay, so these are the things that you opt to look for whenever you're studying about muscles. So this is the brachium, or can also be known as the arm. You can see there. So I've got the muscles of the arm, which are also known as the flexor compartment. Anterior uh, anterior compartment of the arm. So the muscles that we have coracobrachialis, we have biceps brachii, as well as the brachialis muscle. Coracobrachialis muscle, this one is coming from the coracoid process and inserting on the humerus itself, which is on the medial side of the humerus. Also, this is the biceps brachii, as uh, which has got the long head as well as the short head. Okay, biceps brachii has got the long head and the short head. And the brachialis muscle, when you remove the biceps brachii, you find below there is the brachialis muscle. So common innervation of these muscles of the anterior arm, it's the musculocutaneous nerve. So this is the coracoid process that I've mentioned, just coracoid process. You can see that it's coming from the coracoid process. That's of the scapula. Okay, that's the scapula that you can see there. So it sits on the medial border of the middle of the shaft of the humerus. Nerve supply is musculocutaneous nerve. Okay, action, like I said, this is the flexor compartment, right? So it flexes the arm, and this is the muscle that is pierced by the musculocutaneous nerve. So you can see that the musculocutaneous nerve pierces the coracobrachialis. In biceps brachii, like I said, it has got two heads, short head and long head. Short head originates from the coracoid process. Okay, long head originates from the supraglenoid tubercle of the scapula. So on the scapula there, we've got the supraglenoid tubercle and the infraglenoid tubercle. Okay, yeah. So for this one, originates from the supraglenoid tubercle. Yeah, that's about the long head, right? Yeah, so insertion of this one, it's a radio uh, tuberosity, inserted to posterior part of radio tuberosity in a twisted manner. Okay, um, before insertion, medial part expand to form bicipital aponeurosis. Okay, so nerve supply, musculocutaneous nerve. So this is a powerful supinator, as well as also it's involved in flexion of the elbow joint. Okay, yeah, this is a biceps in um, biceps brachii reflex that you try to hit on the joint there here, so as to test for uh, the biceps reflex. Okay, this is a brachialis. Like I said, lower part of the anterior medial and the anterior surface of the humerus. That's the origin. Inserting on the ulnar tuberosity. Okay, it inserts on the ulnar tuberosity. Nerve supply. This one is a modified muscle. It's we say okay, I've forgotten the term that I usually use, but it's applied by musculocutaneous nerve as well as the radial nerve. So its action simply to flex the elbow joint. Okay, yeah. So that's about that. Then in my next video, I'll talk about the cubital fossa, right? Yeah, so I'll explain about the cubital fossa and what's required to bring out. So you're supposed to, one, you say about the definition. What's the definition? Where is it located? What is the shape? What are the boundaries? What are the contents? Then what's the clinical significance? In every other structure, including the femoral triangle, right? Femoral triangle, the axilla. This is how you approach that, right? Yeah. Okay. Thank you.